How do we use a test kit like this to take a SIBO breath test and get an accurate sample back to the lab? My name is Bella and I'm a functional nutritionist and founder of the Functional Gut Health Clinic, where we use labs like this to help clients with SIBO and other digestive conditions take back control of their gut health. In our previous video on testing, we discussed the different types of SIBO breath testing and the different substrates that we can use. So make sure you check that out if you haven't watched it yet. In this video of our SIBO series, we're going to walk through the prep process we need to follow in the days prior to SIBO breath test, how to actually complete a SIBO breath test, and common mistakes to avoid to make sure that you get an accurate sample back to the lab. This video is a comprehensive guide that covers absolutely everything that you need to know to prepare for and complete SIBO breath testing. If you know all of the prep detail and you're keen to get to how to actually complete a SIBO breath test, please use the chapter summaries to skip ahead. Let's just quickly recap testing for a moment. A SIBO breath test is the preferred method for SIBO detection because it's non-invasive, it's simple, and compared to an aspirate culture, it's actually pretty cost-effective. It can also be done at home with a test kit sent to your house from the lab. Today, we're going to walk through how to use one of these SIBO breath test kits. The way that breath testing works is we take a baseline breath sample, then we drink a sugar solution, and then we wait for the bacteria or archaea in our gut to start fermenting those sugars. We then take a breath sample every 15 to 20 minutes for up to 3 hours, which measures the type, the timing, and the amount of gas being exhaled to get a really clear picture about what's happening in your small intestine. If we get a rise or an elevation in hydrogen, methane, or hydrogen sulfide gas within 90 to 100 minutes, which is typically considered small intestine time, we have a positive SIBO breath test result. So basically, if you have an overgrowth of bacteria or archaea in your small intestine, they will take that sugar solution, they'll ferment it and produce lots of gas, and then you'll breathe it out into the test tube every 15 to 20 minutes for the lab to measure and report on. But to understand whether you have a rise in gas levels, first, you have to take a baseline breath sample. And to get a baseline that isn't impacted by bacteria or archaea fermenting foods and producing elevated gas levels, we need to follow a pretty specific SIBO breath test prep process. Most SIBO breath testing companies have a really detailed handout that will come with your test kit covering everything that you need to know to complete the test accurately. This can vary from lab to lab, so your practitioner might give you some additional advice more specific to you. The types of things that we run through are ideally waiting 2 to 4 weeks after a colonoscopy, a barium studies, colonics, herbal antimicrobials, and antibiotics before SIBO testing, especially if this is your first SIBO test. All of these interventions can temporarily lower bacteria and archaea in the small intestine, so we want to avoid this and get a really clear picture about what is actually going on. If you're SIBO retesting, your practitioner may like to retest directly after herbal antimicrobials or antibiotics, so not wait the 2 to 4 weeks. This is especially important if they want to retest before any potential relapse can happen, since we know for some people, they can relapse within 3 to 5 days if they had a lot of damage to their migrating motor complex. So that's also called the MMC. We'll talk more about the MMC and why it's important in a future video about SIBO root causes. It's also recommended that you stop taking prebiotic and probiotic supplements or eating probiotic-rich foods like yogurt, kombucha, or other fermented foods at least 1 week prior to your test. Most labs recommend that you stop taking supplements or medications for constipation 1 week to 2 days prior to testing. So stool softeners are products like magnesium, vitamin C, Ducalax, Miralax, Senna, etc. That said, having worked with thousands of constipated clients, we know that this is not always possible for everyone. So we try to have them stop stool softeners only 1 day prior to testing while they do the SIBO test prep diet. We also like to have them down to just magnesium as their stool softener if this is possible. Again, this is all very individualized, but for those who are really constipated and this constipation is likely coming from methanogens or EMO, we want to get some sort of reading from a SIBO lab, even if it's not perfect. An imperfect SIBO lab is better than no SIBO lab when it comes to constipation. One day prior to testing, and while you're doing the SIBO test prep diet, we also like to have clients avoid all of their non-essential supplements. So things like digestive enzymes, hydrochloric acid, liver supports, and binders. We used to ask clients to avoid antacid and acid-suppressing medications like PPIs for 1 week prior to testing, but we don't do this anymore. We do, however, aim to have them stop 1 day prior if it's possible for them. An article published in the American Journal of Gastroenterology in 2009 shared that PPIs don't affect the SIBO breath test in people who have IBS symptoms. If you're not sure about your supplements or your medications, then make sure you check in with your practitioner before completing a SIBO breath test. Now it's time for us to jump into the next phase of preparation for the SIBO breath test, the prep diet. So the prep diet is all about removing the foods that ferment and produce gas. The goal is to lower gas in the GI tract so that we can see a clear reaction to the sugar substrate when we start the test. It's typically a 1 day or 24-hour prep diet, but for really constipated clients who take constipation support supplements to go to the toilet, we often recommend a 2-day prep diet because of the potential for much slower transit time. So the gold standard prep diet is just fat and protein and no carbohydrates. And this is because it's the carbohydrates that ferment and produce gas. So carbs are things like fruits, vegetables, grains, milk, juice, alcohol, etc. But this is not really achievable for many people, so there are a lot of options out there for SIBO test prep diets, and they vary with the carbs that you can include. As a clinic, we like to start with the test prep options that come with the product that you purchase, and then we personalize specific to you. Carbs that you'll typically see on the allowed food list are white rice, white potato, and sometimes white bread because of how little they ferment and how quickly they're absorbed. So here is a sample SIBO breath test diet from SIBO Test in Australia. They allow baked or broiled chicken, fish, or turkey. They allow salt and pepper for seasoning, plain steamed white rice. They allow hard-aged cheese for those who can tolerate dairy. They do eggs, they do clear meat broth, olive oil at just 1 tablespoon daily for cooking. They allow weak black tea and weak black coffee, as well as plain water. Delicious. The test kit will come with a recommended prep diet, and your practitioner should also provide some recommendations on this based on their experience as well. It can get tricky for people with diabetes, and so your practitioner will be able to assist you here with recommendations for lower fermentable carbs that won't impact the testing and also help regulate blood sugar levels prior to testing. So that's the 101 on SIBO test prep diets. But what do you do if you have more than one SIBO breath test kit to complete? If your practitioner has recommended more than one SIBO breath test to complete, so you have lactulose as well as fructose and glucose test kits, and you need to complete all of them, it's important to stay on the SIBO prep diet between the tests. It may look something like this. So on day 1, you do the prep diet and overnight fasting. On day 2, you complete the glucose test kit. Then you continue the prep diet and overnight fasting. On day 3, you do the lactulose test kit. You continue the prep diet and you do overnight fasting. Then on day 4, you complete the fructose test kit. Then you're back to your normal diet and supplement routine. Phew, okay, I think we're almost done with test prep. It's time to jump into how to actually do the SIBO breath test. Before you start your SIBO breath test, you want to read through the preparation guidelines and instructions that come with your specific test. You also want to make sure that everything that's supposed to be in the kit is there. You'll have 10 test tubes and 10 test tube labels if you're doing the recommended 3-hour breath test with 15 to 20 minute intervals between breath samples. If you're completing the 2-hour test, then you'll have less. You'll also have the test substrate, so lactulose, glucose, or fructose, depending on what your practitioner has ordered, and then you'll have the collection device. You'll also have your referral form that you'll need to fill out and a return box and envelope to get the kit back to the lab. If you have everything in your kit and you completed all of the test prep, so stopping any supplements and medications recommended in the kit and by your practitioner, as well as completing the SIBO prep diet, Then you're good to get started with the test. Because you need to fast for 12 hours prior to testing, it's easiest to complete the SIBO breath test first thing in the morning, ideally about 1 hour or more after waking and brushing your teeth. It's actually recommended to brush your teeth without toothpaste and just rinse with water afterwards. This helps to reduce any high gas levels coming from bacteria or archaea in your mouth. A few other things to avoid in the morning and during the testing period are smoking, exercising, mints, and anything else really other than small sips of water. So the first thing you need to do is to mix up your substrate, the lactulose, glucose, or fructose that you have with 1 cup of water, following the instructions in your test kit. But don't drink this just yet. Now you're ready to take your baseline breath sample. This is a sample that we take before we drink the solution. Hold your collection device in one hand and the test tube in the other. Hold the test tube close to the needle, but don't puncture it yet. Take a normal breath in, put your mouth over the mouthpiece of the collection device and blow out normally. You'll inflate the collection bag with your breath. So there's a small hole in the collection bag that will leak a small amount of air. This is very normal and what we want to happen. Mid-breath, and when the collection bag is fully inflated, push the test tube onto the needle firmly so that the rubber stopper on the test tube is punctured for about 1 to 2 seconds. Next, you want to take the test tube off the needle, but before you finish your breath. This is really important. Make sure that you've collected 1 to 2 seconds of breath and then remove the test tube before you stop blowing out. Here's an example. These are self-sealing tubes, so once your breath is in there, it'll stay in there. When you finish collecting your baseline breath sample, write the collection time, date, and your name on the label and affix it to the tube and place it to the side so that it doesn't get mixed up or reused. Now it's time to drink your pre-prepared substrate solution. So try to do this within 3 to 5 minutes of your baseline sample. After you drink your substrate solution, set your timer for 15 or 20 minutes, depending on what your test kit or your practitioner has advised. And then you want to collect your second breath sample 15 or 20 minutes after finishing your substrate solution. So all of your samples must be collected at 15 or 20 minute intervals until all 10 samples have been collected. And your practitioner will give you guidance on whether they would prefer you to collect every 15 or 20 minutes. And if you're not sure, go with the 20 minutes. If you collect a sample late, then please make sure that your next sample follows the original time schedule. Take the time between each sample to label each of your test tubes accurately with the sample number and any other required information like your name, date, and the substrate solution if you need to have this on each of your test tubes. When you've collected and labeled all of your samples, put them into the bubble wrap return bags and place them back into the test kit box. Make sure you include your referral form and post the test kit back to the lab for analysis, ideally within 3 days of collecting your breath samples. So most breath samples are viable for up to 14 days after collection. Completing the test on a Sunday and posting it on Monday is typically the best timing to ensure it's received by the lab as soon as possible from the time of collection. For most people, the weekend is also an easier time to do the collection so that they can put aside 3 hours with less interruptions. And because if you have SIBO, you may get symptoms from completing the test. So having diarrhea, gas, or bloating after testing is typically easier to deal with when you have more control over your time. Once you send your test kit back, you can expect results within 1 to 2 weeks, depending on the lab. Let's just touch on some of the common testing mistakes to avoid to make sure that you get an accurate result and that you don't waste your money or all of your time and energy that this process needs for us to put into it. The first is really the prep diet phase and making sure that you get this right. You need to be careful with the foods that you eat during that period, as well as the supplements and medications that you're taking or anything else that you're putting through your GI tract. You don't want anything fermenting in your gut when you start to take the test, because this will read as a false positive test result and not true SIBO or EMO. So have a plan for meals and supplements during the test prep phase. With an incorrect test prep, what you might see on a test result is a high baseline that either stays high or slowly goes down in the first 60 minutes. And that really stops us from getting an accurate read on any gas elevations, which is what we're really looking for. The second most common mistake we see is the actual breath collection process itself. It can get a little challenging here, particularly at first, to line up your breath with your hands and puncturing the tube at the right time. It's easy to get a little anxious about this if you've never done it before. If you spent hundreds of dollars on the test and you want to get an accurate result. The best thing to do here is to try to not be in a rush and to take a calming breath beforehand and know that hundreds of thousands of people have completed this before you and that you are very capable. I believe in you. Just take your time and follow the instructions. And the third most common mistake we see is with accurate test tube labeling. So if you've got all the prep right and you've spent hours collecting your samples, the last thing that you want to do is get the label wrong so that the lab doesn't know which sample is which. Some instructions suggest labeling everything at the start, but I personally suggest labeling each test tube as you go. You have plenty of time between test tube collections, and I've found this way you're less likely to mix it up than if you're picking up a pre-labeled test tube. The numbering of these tubes from 1 to 10 lets the lab know the order that they were collected. This is the most important part of your label, so please double check that they're all numbered. So by following these detailed steps, you can successfully complete your SIBO breath test at home, making sure your practitioner receives a really accurate result to inform next steps on your healing journey. You've got this. In the next video, we're going to discuss how to interpret the SIBO lab report that's been emailed through to you or your practitioner so that you can actually understand whether you have tested positive for SIBO or not.